Hello, everyone, and you're very welcome to this episode of Let's Talk Sheep. I'm your host for tonight, Ciaran Lynch, and we're going to look at flock health in the lead up to lambing and some more general aspects in this episode. I'm delighted to be joined by Shane McGettrick and Maresa Sheehan from the Regional Veterinary Labs in Sligo and Kilkenny, respectively. Shane, Maresa, you're very welcome on. I'll just get you maybe on mute and come on the camera.
Hello, Ciaran.
Hi, Ciaran.
Folks, look, it's great to get you on. I know we're heading into your very busy season at the moment, so we appreciate you coming on with us. Look, you're going to cover some general aspects of flock health, focus on some of the key things we need to focus on in the lead up to lambing, and maybe some things on the horizon over the next hour or so. What I might just do, I get Maresa, I think you're going to go first. I might just get you to start sharing your screen. I'd like to just remind our attendees tonight, you can ask questions via the Q&A tab. You'll find that at the bottom of your screen. So if you put the questions in, I'll ask Maresa and Shane on your behalf. What we might do is, Maresa, we might take some of the questions maybe halfway through. I think there's kind of a logical break between yourself and Shane on it. I know you're going to be doing a bit over and back between you. So we might take some of the questions at that point, and look, we'll have a wrap-up session at the tail end where we can ask any questions come in and maybe talk about some of the more general aspects you're covering tonight. So with that, Maresa, we've the slides up, good to go. I'll hand over to yourself and Shane, and look, I'll join you again halfway through.
Thanks, Ciaran, and thanks a million for the invitation to come on here and talk about flock health. Both myself and Shane hope it's useful, and we're more than happy to answer any questions and hopefully give you a bit of heads up on what we're seeing and maybe some measures that you might consider taking before the busy lambing season coming up. So I suppose we always kind of think as regards flock health from farmers that are coming in here with sheep, and sometimes when we give them a diagnosis, they actually know in some way that something has been wrong going all along, but they actually weren't sure. So I think it's very important that sheep farmers keep good records so that they can actually record what's happening and then assess whether there is a problem, what might be causing it, and then maybe getting help to solve it. So I think it's human nature. If you become kind of familiar with problems, maybe you don't recognize them or you don't actually perceive them as a problem. So actually kind of keeping hard code records is a really essential way of seeing if you have an issue on your farm. So I think key things are how many adult sheep and lambs die each year. So that's a basic bit of information, and then you can assess your performance against your peers and see if that's acceptable, if there's room for improvement, what are causing that, what age are they when they're dying, and what are the major causes of death in their flocks. And then I think you can get your Teagasc advisors, your vets, to try and set key parameters then on how to improve that and take simple measures to try and improve the health of your flock. So let's start kind of this time of the year in the regional vet labs. Now we start seeing fetuses. So for lamb fetuses, we can't stress enough the importance of bringing the afterbirth, the placenta, because a lot of the agents that cause abortion will target the placenta. And if we can see that, we get a good advantage in trying to get you a good answer back. So when should you submit samples? Definitely if you get a cluster of abortions, or if your abortion rate is approaching anywhere near 5%, you really need to start submitting samples and trying to see what's going on there. The heavy hitters as regards abortion are enzo or enzootic abortion caused by chlamydia and Toxoplasma gondii. So they're accounting for a lot of the abortions that we see. The interesting thing is that while there's a lot of vaccination going on against Toxoplasma, there isn't against C. abortus. So just in a study we did with sheep farmers around the RVLs in 2016, only 15% were carrying out vaccination against enzo, but we did have evidence that there was circulation of it in 63% of the flocks. So there just seems a bit of a disparity there. So maybe that's one to discuss with your vet or Teagasc advisor, just to see if that would be something that you should consider vaccinating against. This is just a section of a brain that we see down the microscope, and this is a lesion of Toxoplasma in the brain tissue. I suppose I should warn people who are having a late T. There are some quite graphic images, I suppose, coming up just to show these kind of diseases. But if you're of a just warn you just that there are some images coming up. So this is an afterbirth. So here we're assessing kind of between the cotyledons or the buttons and the buttons themselves, and that can give us a really good hint as to what might be causing it. It's no harm probably to mention this year that in Kilkenny we diagnosed our first case of Schmallenberg the week before Christmas. So it's probably not unexpected. Schmallenberg virus seems to have a kind of a life cycle of 5 to 6 years. So it circulates, then a bit of flock and herd immunity builds up, and it disappears for a few years. So now is about 6 years after the last time we had that incursion. So we certainly did pick it up before Christmas. We probably expect to see a few more. The interesting thing, I suppose, this year is with the blue tongue situation in the UK, and blue tongue can occasionally cause sort of brain deformities and that if sheep are infected during pregnancy. I think it would be great if people kept submitting sheep or lambs that are a little bit unusual looking, even if they're not approaching those numbers, because it really would help surveillance for these diseases. And so this is a Schmallenberg brain, so it really affects the virus, really targets certain sections of the brain, and that's what causes those horrible deformities in lambs as well. So what samples to submit if you are getting a few abortions, aborted fetuses and placentas? Again, it can't be stressed enough. Submit from a number of aborted ewes, and we have to hold our hands up. There's limitation to all our testing and to all laboratory testing. So if at first you don't get an answer, keep coming back with more material, because eventually we will hit the target. And sometimes not getting an answer is a reassurance at least. So if we haven't picked up one of the heavy hitters or the Campylobacters or that, look, at least that's a sense of security. And then sometimes blood from the yolk can be a very good help as well, and an aid to diagnosis. So perinatal deaths. So that's the next thing then. So what causes death around lambing, and what can we do to prevent it? So these are basically what causes dystocia. So inappropriately sized lambs for wrong size ewes, and then anoxia, hypoxia, so sheep that are a bit slow lambing, or a bit of hypocalcemia or that, and then just stillbirths. That can still be a hangover from some of the abortive agents. Then traumas, bacteremia, septicemia, so that's all down to cleanliness and dipping of navels. So they're the big heavy hitters. So what can we do to reduce perinatal mortality? Obviously, healthy ewes in good body condition score. Now again, because of the autumn that we had, that very wet, mild weather, and the level of parasitism, the fact that there's probably less straw around, there's probably maybe a shortage of fodder to feed lamb or sheep if you're housing them, or to bed them properly. Body condition score might be an issue this year. So we may be looking at maybe an increased incidence of kind of twin lamb disease and a few things like that. So it's just something it's really good practice to body condition score your ewes, because as all sheep farmers know, it's impossible really to assess body condition score without actually getting your hands on the sheep. Clean environment. Do you clean out individual lambing pens regularly? I remember being at a talk that Tim Keady from Teagasc was giving, and the percentage of people who clean out lambing pens between lambing is really low, surprisingly low. So people don't routinely do it. So again, that might be just a simple measure to try and improve hygiene. Obviously, giving colostrums or bee stings is essential. That's your first key thing to always try and make sure that every lamb gets their bee stings. And prevent hypothermia if you're outside, provide some shelter. Then we see these are the trauma ones where the ewe has stood on the lamb, or something else has stood on the lamb and cracked the ribs, and obviously resulted in the death in this case. So then moving on to what do we see as the causes of death in lambs between birth and 1 year of age? So I think when myself and Shane were pulling this presentation together, what kept jumping out of us when we were looking through the figures of submissions to the RVLs and that was what a key role parasites play in sheep. So GIT infections, so gastrointestinal infections of the gut, caused death in 29% of our submissions, and 62% of these were parasitic. Systemic infections, so they are the pasteurellas. So Biberstinia and Mannheimia are just different names for the pasteurellas. So they're the ones that can cause pneumonia, angiobacteremia, septicemia. So they're causing 14% respiratory disease. That again refers to sometimes your pastorellas, and then of course your clostridial diseases. And Shane will be talking about clostridial vaccine later on, and now really is a good time to just put that back in the to-do list, is to make sure that yours are well vaccinated against Clostridia before they lamb down. And then what are the causes of death in adult sheep? Again, your respiratory disease, so your pastorella pneumonias. Then we're into your metabolic and nutritional, so your ruminal acidosis. We always see quite a bit of that in sheep flocks, in store lambs that have been recently housed. And we see a bit of that, hypocalcemia then, and pregnancy toxemia. And remember, we think this may be a higher risk this year just because of that poor body condition score coming off a wet and dirty autumn with lots of parasites around. And again, GIT infections in adult sheep, 65% of them parasitic. And we'll come back to the parasites in a minute or two. Then systemic infections, and then the neurological. So that's 7%. So your listeriosis, typically from poorly conserved silage that's gone a bit musty. And then CCN, that's the one where they start stargazing. That's usually due to a change in diet or some other stress factor as well. So this is a lung from a sheep, and this is a lung that should be nice and pinky and soft looking, kind of bouncy looking. And this is a sheep with Pastorella pneumonia. So you can see that really prevention is the way to go with this, because trying to cure that with injections is futile when it gets to that degree. This is just a picture of what we see regularly in the lab, is sheep that have engorged themselves in too much meal and died of ruminal acidosis. So sustainable parasite control. So I'm being a bit smart and a bit cheeky when I'm suggesting what people should take on as their New Year's resolution in 2024, and that is to understand parasites. Because I think more and more in the labs, we're dealing with farms that have a very serious parasite problem, where it's affecting thrive, productivity, and ultimately profitability and the sustainability of sheep enterprises on farms. So I think if nothing else that you do this year, it's to get a really good grasp and hold and understanding of parasites on your farm, the drugs that are working, when to dose, when not to dose, taking fecal samples. All that is just essential, I think, if you want to stay in sheep farming in the future, because it really is coming to the stage where people are lacking drugs that will work, and it really is affecting the bottom line and thrive and health and welfare of their sheep. So Teagasc and other stakeholders, including ourselves and UCD, have come up with these guidelines: is don't use yos unless there's a demonstrated need. Now, hogget yos might be an exception. They might certainly need a dose, but that should be assessed on a case-by-case basis. So where possible, do not blanket treat yos. Use a white trench for the nematovirus dose in the spring, because there's very little resistance shown to this. So that's a good one to use in the spring. So you're keeping your other drugs active for later on. Always do a quarantine treatment for bought-in sheep. Remember, you could be buying in parasites that are resistant. Remember, it's the parasites that are the resistant ones. So always make sure they're treated and kept apart from your own sheep. And then use fecal egg counts and drench tests. And I think with TASs and with sheep welfare schemes and that, everybody's getting more used to those. And I think hopefully seeing the benefit of those and then doing targeted kind of control measures. So in the southeast where I am in Kilkenny this year, last summer, we certainly saw a lot of very pale sheep with some bottle jaws, some swelling under the jaws, and with a lot of these worms. If you can see where my cursor is, these little barber pole worms in the stomach of the sheep, and these here again, and these are Homunculus contortus, or barber pole worms. Possibly likely due to the milder weather. So we're seeing a lot of these on farms. So it's really important to know if you have these on your farm. If you do, then you have to know which pastures might be contaminated, and you have to keep very close look on your sheep. But also, if you don't, you want to keep it out. So again, stressing the importance of your quarantine treatment for any sheep that you buy in. There's another guy there, if you could just see him. So very common diagnosis in 2022, probably more common down here and up to the Midlands, more so than the Northwest with Shane. But I pass over to Shane maybe for a comment on these ones, because these are rumen fluke larvae, of which sheep died this year as well. Not as much of a problem in the southeast because we're slightly drier climate. But Shane, I think you would have seen a lot of clinical cases and deaths due to rumen fluke.
Yeah, Maresa, this year was a particularly bad year for rumen fluke. We saw it on wetter ground, and what we noticed is it took farmers by surprise. You know, it's one that can strike out of the blue, that you get very little warning on it, and then suddenly you have a lot of sheep affected and quite sick with it. What we see, the common thing with it is that the sheep have been grazing ground that has got quite wet, standing water usually on the ground, and that provides a habitat for the intermediate host, the snail, which affects them. But the big thing we see with it is that it affects a flock of sheep quite quickly, and out of the blue, when you get no warnings with egg counts or things like that with it, it's really just a differential diagnosis to have there when you see a group or a flock of sheep become very sick. And the most common description I used to get from farmers in the midst of all this was, the sheep had got dull. They had got very quiet and dull all of a sudden. And the losses in a flock can be very variable. And really, the only way of getting the diagnosis is a PM on them. We're relying on seeing pictures like you have up there of the histo of the actual fluke eating the mucosa to be able to get a firm diagnosis of it. Again, it's as with all the parasite things, it's about understanding the particular parasites that might be on your farm, the risk of them, and factoring in the particular weather conditions that are happening. So we got caught out with it this year because we got such a wet and mild back into the year.
And Shane, maybe to go on, because again, I think it affects your end of the country or your side of the country more than here. Certainly in the last few years, we wouldn't have seen as much of it. We saw a bit of it this year. And liver fluke, is that continuing to be a big problem as well?
Yeah, I'm very worried about liver fluke this year. Every day we're having cases of it coming through the PM room in sheep. Every single day, it's the first thing now that it's the most popular diagnosis we have at the minute. Catching a lot of people by surprise because they have dosed in the same way as they have done every year up to now. But again, there's a few factors in play here. It's been a very mild year. There's been, up until this week, we've had no frost at all. Now, this week there has been some frost, so hopefully that'll quieten down the infective dose that's out on fields. But what we're seeing is people that have dosed as normal for fluke, and then put them back out onto what is very heavily contaminated pasture, and they're getting acute liver fluke disease then showing up 5 to 6 weeks later in them. And you talk about the abortion issues and things like that. I'm worried about the body condition of the animals in this part of the country, and I'm advising everyone is that they need to consider, is there a fluke problem on their farm coming up towards lambing, because I'm worried that the livers in a lot of these animals are going to be very severely compromised, and that it's going to lead on to more problems around lambing time with weak lambs, dead lambs, and increased metabolic disease there, things like the hypocalcemia and the pregnancy toxemia, where the animals just they're not able to keep the energy coming into them because their livers aren't working properly.
Yeah, thanks a million, Shane. So yeah, these are basically rumen fluke larvae that, and you can see this is the lining of the gut. If you have these parasites actually taking, for want of a better word, chunks out of it, it's not going to do anything for the health of your sheep. Down this side of the country, we see plain dehydrated lambs with dirty backsides, and it's basically parasitic gastroenteritis, so it's your stomach worms. And we see very high levels of that. Even this week, there was sheep that came in with 7,000 stronger legs per gram, so that's a huge worm burden. So there still is, as Shane was saying, this is really the first frosty week we've had, so it has been mild and wet. It's a parasite paradise, basically. So DAG scores very high, sheep and bull body condition score, and very watery intestinal contents. So just always be looking at that to kind of see what is the consistency of fecal material that sheep are passing, and what, again, putting your hand on sheep to see what kind of body condition score they're in. So this is what we see in their stomachs, little bumps and things that mean that, you know, there's a lot of stomach worms going on. And again, here, this kind of really roughened appearance in abomasums, a real sign of stomach worms. So I guess with all this, with any health issue that you're facing, it's always that marriage of the environment. So you want to keep the environment as favourable and as clean and as dry, or in the case of parasites, clean pasture, dry pasture, less infested pasture, so that, you know, where young lambs haven't come off, or store lambs, you know, which might be having a heavy worm burden. Then the host, you want to keep the animal itself in good body condition score, in a good plane, at a good plane of nutrition, well treated for any diseases. And then the actual bug itself is only 1/3 of it, because sometimes we get a bit taken up with the actual bug that's causing the disease. So you sometimes get farmers here, and rightly so, I do the same myself. What exactly is causing the pneumonia? What is the bug that's causing it? But actually, yes, that's a help to know that. But you must also go, well, what was stressing my sheep that made them susceptible to this? Because these bugs are knocking around a lot of the time. They're just sitting there waiting for the chance. So if you have a stressful environment that is, you know, your nutrition isn't great, it's overstocked, and then you have a host that's in a lower plane of nutrition, that's the animal that will get sick. So it's just to try and keep those balanced as best we can. I think, Shane, you're going to go for the next half of this and maybe talk a bit of iceberg diseases. So I'll stop sharing this, and Shane, if you want to get that set up there.
I'll let Shane get set up. Just Shane, Maresa, just when we're waiting, like I'm conscious you covered the abortion bit of it. Probably an important aspect to consider. A lot of these abortive agents, like Enzo and Salmonella, I'm thinking of here, they are also zoonotic. Like there's a human health risk to how we handle these abortive feces, and just in general, that can't be underestimated.
No, it can't. And actually, I should have said that, Ciaran. Thank you. It's especially for women who may be pregnant or getting pregnant or don't know that they're pregnant. You really should be avoiding the lambing shed, and particularly avoiding any aborted fetuses or anything like that, because they're very, very dangerous, and the result and the repercussions are so serious it can't be underestimated. But also, we did a bit of a study on kind of farmers' awareness of zoonosis and sort of things like, you know, even lambs that are scouring, you know, bits of crypto, all those factors. It just really needs everybody to be kind of, right, I have to wash hands every time I come in. I have to leave dirty boots or overalls or that away from young children, because we've all heard stories of, you know, children playing around in dirty boots or overalls and stuff like that. They're just all risk factors. So just real common sense, no eating outside while you're doing work, washing hands, cleaning boots, bit of a foot bath, but really you're so right as regards the toxoid, the Enzo. They have such huge implications for pregnant women to really, you have to avoid those situations at all costs.
Certainly, try and leave any of them issues on the lamb shed and not bring them in with you.
Yeah.
Shane, we have you open sides. Look, I just remind our attendees again, if you have any questions for Shane and Maresa, just put them in the Q&A tab at the bottom. I see we have a couple in. We'll get to them at the end. If there's anything else crops up, by all means, put them in and I'll ask them on your behalf. Shane, look, I'll hand it back over to yourself and I'll join you again at the end.
Okay, thanks, Ciaran. So what I'm going to talk about is some of the diseases that are present on farms and some of the preventative measures that can be taken for them. First thing is the thin yaw survey and iceberg diseases. So I always think iceberg diseases is a nice name for something that's very nasty. So this is in relation to, there's a number of diseases that are called iceberg diseases, where what you see of them in a farm is only the tip, and that they are causing a lot of disease subclinically, disease that you mightn't notice as being that particular bacteria or virus, but that are eating away all the time at the efficiency of the animal, at the profitability on the farm. Um, the other thing with most of these diseases is that the diagnosis of them is not easy. And the best way of diagnosing them is usually through post-mortem examinations. And um, that's why we have this particular scheme, and we've had it going for a little while now, and we're going to be nearing the end of it. But we're encouraging anyone that has that any of these things I'm about to talk with ring true to them to consider getting included in it, because I think it can give a lot of value to a farm in knowing what's there and what's causing the problems. So the iceberg diseases that we consider are border disease, caseous lymphadenitis, medivisna virus, ovine Johne's disease or paratuberculosis, and ovine pulmonary adenocarcinoma. So I'll go through a little bit about them one by one. So ovine Johne's disease. So this is a disease caused by a mycobacterium, part of the same family that causes TB. But this affects primarily the intestines, and it's a real chronic disease. It builds up over time in the intestines. It causes thickening of the intestines. It causes a lot of the animal's energy to be spent trying to fight it off, and it causes the animal not to be able to absorb all the nutrients that it's eating. So what you typically see happening on a farm is you start to see more than the normal number of thin animals, and it can't be explained by other things like parasites or poor teeth, things like that. The second one then that we test for is border disease. So this is a flavivirus. It's in the same family, and it's basically the sheep version of BVD that the recent eradication scheme has been focusing on in cattle. Now, border disease is very similar to BVD in how it affects sheep. So what we see is we see lambs that are born with a very low birth weight. They often have a hairy coat because the virus itself affects the development of the hair follicles. So the coat looks different than you see in a normal lamb with single hairs standing up. It can affect their nervous system, so they can have a tremor. And together with that, they often have very poor conformation because the nervous system isn't able to stimulate the muscles during development properly. These little lambs, I suppose they look a little bit cute in some ways, but they're very, very, very sick animals, and they don't survive and they don't thrive. And it's often worse in a flock if they do survive, because they spread the disease onto other animals in the flock. We call them hairy shakers. What you might see in yawns if there's a border disease problem on a farm is barren yawns and an increased number of abortions. Medivisna disease or medivisna virus is a disease we thought we didn't have in the country. Maresa and her colleagues in Athlone first detected our first case of it back in Kilkenny, I should say, detected our first case back in 2020. The problem with this disease is that it has a very long incubation period, and it causes the worst disease in animals that are older. So from 4 or 5 years on is when you start to see a disease that's completely incurable. There's nothing that can be done to cure it once an animal has it. There's two forms of it. It comes the medivisna form. So the medi form refers to a pneumonia. So basically what happens is you get very severe inflammation on the lungs. The lungs stop working as well as they should, and you get an animal that'll become ill thrifty. You can with that see mastitis, but it's not always the case. And there are a lot of other forms of mastitis. So just because you have mastitis in a few ewes doesn't necessarily mean it's medivisna, but it could be part of it. So it's important to get them checked. The visna form we see very rarely, and that's basically neurological signs. As I say, the control options for a lot of these diseases were very limited in them. The nuclear option is always depopulation and repopulation, but that brings with it the problems of how do you depopulate. You know, it's not very ethical to move these animals onto other farms because they're only going to spread disease in other farms. The best thing is to know it's there and to get in and start culling and start having a culling policy on the basis of knowing you have disease there. Things like separating younger animals from older animals, because it's the older animals that have the clinical signs with medivisna especially that affect the younger animals. Things like, we know that when an infected animal has a lamb, that it's more likely that that lamb is going to become infected. And one of the ways in which it can be infected is by the close contact during suckling. So artificial rearing of lambs for, I suppose, would be high value animals might be warranted in some cases. And probably a lot of you have heard about this and, have dealt with caseous lymphadenitis. We see quite a bit of it. There's a lot of it out there on farms. It's basically a bacterial disease that causes chronic inflammation in the lymph nodes. It becomes more noticeable when it's in the superficial lymph nodes, and you can get these weeping or very swollen lymph nodes, particularly around the head. But what we see in a lot of these cases, and up to a quarter of them, is that there's internal lesions as well as the superficial head lesions. The way in which this is spread, and probably the most likely way it's spread on farms, is the bacteria entering cuts that occur during shearing. But it can also be spread by ingestion and inhalation. These abscesses and these weeping abscesses that can occur on the animal's head, they're full of bacteria, and they're a real source of infection to other animals. Because it's such a chronic disease and because it has such a deep hold in the animal, antibiotic treatment doesn't work with it. It really, again, the most effective solution is to depopulate and restock, but failing that, screening, identifying the animals that have with it. We have blood tests that are quite effective for identifying this disease in live animals, but it involves repeated blood tests and checking animals repeatedly, trying to pick out the positives and then putting them into the culling policy. What's important to know with those blood tests, that blood test shows that it has had exposure, the animal has had exposure, but it doesn't always mean that it's going to become one of these severe cases. So it becomes a toss-up and a decision for the individual farmer based on the risk there. What does work though when dealing with CLA is segregating the flock into clean and dirty, and making sure that, especially around shearing time when animals are most susceptible to this, that maybe start off with the younger animals, move on to the older ones, and then move on to the ones that you suspect may have it. Never go do it the other way around, because all you're doing is contaminating the whole area with the bacteria there. And then ovine pulmonary adenocarcinoma. So this is, from a pathology point of view, this is a very interesting disease because it's a virus that causes cancer. There's very few viruses that do this, but sheep are lucky enough to be one of the species where it occurs, and it occurs quite often. So what happens in this is that the animal gets exposed to the OPA virus. It then causes transformation of some of the cells in the lungs, and they start to form a tumor, and they form a glandular tumor that produces a lot of mucus. And over time, this takes up space in the lung. It produces a lot of mucus, which the animal is basically drowning in there. And all that results in very poor production, and it gets progressively worse. It's also quite contagious. Some of you may have seen it being done or heard of it being done, the wheelbarrow test, where one of the older diagnostic ways of looking for OPA was to lift poor affected ewe up by its back legs and see the mucus come out the nose. That's how severe these are. I see them here coming into PM, and there can be huge amount of mucus there in their noses. They're literally drowning in what they're producing. Now there are more recent diagnostic methods, including ultrasound scanning of ewes, that I think has potential. But again, a lot of it depends on the individual farm, and having a policy in place, first of all, to know you have the disease, and then to deal with it, and to have a plan in place that you can deal with it. You won't deal with it all in the first week, month, year. It's a thing that needs to be done over a period of years and a period of time. But there have been good case examples there where it has been dealt with very effectively on farms. So that's really what the aim and purpose of the Thin Ewe survey that we've been doing is to try and, identify these problems on farms where, a farmer feels that, there's something going on here. There's something that I want to check for. And we're offering this service free of charge to flock owners to help them identify what's going on. And we in some cases, what we see is that it's simple things. It's none of these iceberg diseases that's causing the problem. It's parasites. We, especially here in the northwest, we see an awful lot of parasite damage in sheep, and we see a lot of chronic parasite damage, liver fluke and stomach worms, where the animal, it's impossible for it to thrive. There's just been so much damage done there in those organs. So if you wanted to avail of the Thin Ewe scheme, how you do it is you agree to submit up to three Thin Ewes to one of the RVLs. Contact your local RVL, and we'll organise to get the animals euthanized, and we'll do the post-mortem examination free of charge, and we'd feed back those results to yourself and your vet. As I say, we have to put a cap on the number of farms we're able to check, but there are still plenty of spaces there if people want to avail of it over the next few months. So just moving then on to more general things about what we can do to prevent disease in flocks. Main thing, I keep going back to it, is biosecurity. And biosecurity is something that I think we all know the words, but we take a lot for granted. Things like, making sure that boots are clean, having dips in place. Sometimes I think it can be looked at as a tick box exercise, maybe when the Board B inspection is happening or when the DAFM inspection is happening, but the reason it's there is because it does work. These diseases have to get onto farms some way. They have to be spread through farms some way. And one of the ways that happens on farms is through dirty boots, dirty overalls, people coming from one flock and helping out in another flock. That's how things can be spread. It also biosecurity encompasses the movement of animals, and Maresa there talked about, from a worm control and from a fluke control point of view, the importance of quarantine. But that also works for a lot of other diseases. And by, if you are buying in sheep, if you are bringing other animals onto your farm, it's always a good idea to keep them separate from your own flock until you see what's happening with them. Avail of whatever tests are there to give you a bit of peace of mind. But a lot of the more common diseases will show themselves, over a period of 3 or 4 weeks. And it's worth thinking about quarantine every time, a batch of new animals are coming in. Makes a lot of sense. And it's so many times we get outbreaks of bad disease outbreaks, and when we question back, it's related to a new animal coming onto the farm at a particular point, and that's the source of it. I'm going to talk a little bit about the various vaccines that are available. out there. Again, it's the time of year where I think everyone needs to be putting in place their plan for the year. What are they going to vaccinate against? What are their problems on the year? And Maresa talked about the importance of good health records, good mortality records on a farm. But my advice to everyone is this time of year, before things get hectic, look back at what happened last year. Farmers have a bad habit of forgetting, what happened in the spring because they got away with it in the summer, or they got away with it in the autumn, or lamb prices were good in the autumn. But depress yourselves, take the step of looking back at what happened last spring. Is there anything that can be done now to prevent that heartache over the next few months? The first vaccine I want to talk about is the Clostridial vaccine. It's probably the most commonly used vaccine on sheep farms, and there's a reason for that. It's a very effective vaccine. It works very well. There are a huge range of Clostridial diseases that can cause problems in flocks, and I'm supposed to be an expert on these things, and I find it hard at times to get my head around it all. When it comes to Clostridial disease, and it's important that that you remind yourself of how the vaccine works and when's the best time to use it, and all of those things need to be tailored individually to an individual farm. So it's worth just having a bit of think about. Read the package insert. Look at the advice on that. There's an awful lot of advice on that on what you should do. Talk to your vet. They'll be more than happy to have a chat with you, especially if you're going to go on to buy a vaccine on it, and they'll give you the best advice for what you can do. So the sort of things, the most common Clostridial diseases we see probably are in very early life. We see Clostridial diseases causing scours and sudden deaths in very young lambs. And then as lambs get a bit older, we see pulpy kidney, and pulpy kidney is a huge disease on Irish farms. It causes very rapid, very sudden deaths, and it's often the best sheep in the flock that die from it. We see it occurring when sheep start grazing, and especially when they go on to a creep ration or on to concentrate rations, and that's because the introduction of new food causes a little change in the bacteria that are in the gut there, and you can get an overgrowth of the particular type of Clostridial bacterium that causes pulpy kidney. But as I say, the vaccine works very well. When I'm thinking about pulpy kidney in an animal coming into the post-mortem room here in Sligo, I always check to see, was it vaccinated? We ask the farmer that at the desk, and rarely we see the disease in animals that have been properly vaccinated. Now, there's myths out there, and there's things that we can talk about maybe in the questions about the proper way to vaccinate. There are when it comes to Clostridial disease, there's an initial course that can be given to ewes. That the aim of that is to produce antibodies in the colostrum that will then protect the young lambs early in life. But those antibodies wane as the animal grows and as the lambs get a bit older, and then the lambs are required to be vaccinated, and it's important that they get the full course of it, that they get the 2 vaccinations. I think they're advised to be given 4 to 6 weeks apart, and that's really to prevent pulpy kidney, that sort of thing that can affect them later in life. Some of these Clostridial diseases can cause problems in older animals, things like black disease there, where especially in fluky areas where you get migration through the liver, and that can start some Clostridial diseases to appear in sheep. And the other sort of things is braxy, where the animals have get it in their stomachs. So pneumonia vaccines, then quickly on to a lot of these are present in the Clostridial vaccinations, and some of them can be also got separately. Main thing that causes pneumonia in sheep is Pasteurella. Again, Pasteurella, the main time we see pneumonias is when lambs or older animals are under stress. So it usually coincides with maybe they've been grouped together for dipping, or they've been grouped together for shearing, or they've been housed, or that the diet have been changed. And sheep are very susceptible to pneumonias. Here in the northwest, we have quite a few tick diseases, especially tick-borne fever, which can affect the immunity of the animals. And we often see pneumonias concurrent with outbreaks of tick-borne fever. And we see that pneumonias happening in sheep at pasture where they have no right to get sick, and it's because they've been exposed to a tick which has given them this particular bacterium, tick-borne fever, which reduces their immunity, and then you get an outbreak of pneumonia on top of that. Another very popular vaccine, but I think an underused vaccine, is the vaccine against Enzo. Maresa talked about enzootic abortion, and this is chlamydia in sheep. It's a live vaccine, so it shouldn't be used in pregnant animals. It's important to use it in animals that haven't become pregnant. So we're probably late this time of year to be talking about it in, for this year. But what I see time and time again with outbreaks of enzootic abortion, and they can be very severe, but what I see is people have got a warning the year before. When you question them in the face of a massive abortion storm about what happened last year, they'll be saying, "Oh yeah, there was a few abortions last year, or but we never got them checked, or we got them checked and we got back a diagnosis and didn't act on it with the vaccine." So it's one that if you're not doing, it's one to be considering as soon as you see an abortion occurring in your flock. And it brings back that the important thing with when you do see abortions is to get them checked, so you know what's causing it, so that you're not wasting your money. If it's not enzootic abortion, you don't need to worry about it. Peace of mind in that. And our tests for those are quite good. So we tend to catch any of them that come through, as long as we get fetuses in good condition and we get placentas, because that's what our diagnostics is based on. There's very little we can do with rotten tissue. The bacteria and everything are gone at that stage. Another abortion vaccination, and again this is one that people use when they have been caught, is toxoplasmosis. It's a live vaccine, and one injection gives lifetime protection. But what's important there is when replacement animals come into a flock, that they get the one shot, because sometimes we see it where we get an outbreak of toxoplasma in a hogget bunch, in a hogget batch that just have missed out on the vaccine. Again, biosecurity is very important when it comes to both toxo and enzootic. And I'm not sure if we mentioned it earlier, but removal of the birth fluids, cleaning of the pen where the abortion has occurred, and isolation of the animal that is aborting. A lot of these abortions are spread in the birth fluids and in the affected fetuses. So just to, if you got an animal that aborts, have an isolation pen ready, get them out from the rest of them as quick as you can. Quick word on lameness. Everyone's always very interested in lameness because it's on every farm to some degree. Again, you have to use a guideline of when it's a problem or not. So I think the guidelines we use is less than 5%, and preferably less than 2% of animals lame. I think in most farms, most farms are touching that a lot of the time, that 2% anyway. There's no two ways around it. Foot bathing is the answer, as far as I'm concerned, when it comes to dealing with lameness, and correct foot bathing. I think the Teagasc recommendations are that sheep should be foot bathed every time that they're brought in for handling, and I think that's very sensible. you know, every opportunity you get, you need to try and take care of those feet, and especially if the animals are on marginal ground, or if you know, if the particular breed of sheep tends to have soft hooves or is more prone to lameness, you know, or if there has been previous incidents of lameness there. So again, I'm no expert on how to do the foot bathing, except I know it works. But the recommendations are there that, you know, they need to stand in the foot bath for longer than you'd think. So, you know, it's not just a matter of running them through it, it's they have to be in contact with these disinfectants for at least 4 minutes. There's various cocktails that can be used, and I've mentioned some of them there. And then the other important thing that I've seen people miss out on when it comes to foot bathing is, you know, letting them back out straight away onto wet ground, or through puddles on the way out, or back onto dirty ground straight away. They need to stand after they've been through the foot bath to let it soak into the foot to get the most kill out of that disinfectant. Really, what you're relying on there is that disinfectant that's in the foot bath gets in and it kills out the particular bacteria that are causing the lameness. So we have a few pictures of poor old lame sheep here. This one has a problem there with the left fore, grazing on the knees. Again, very common sight in most flocks. And then the severity of what we see when it comes to foot disease in sheep is, you know, it's huge. This one is probably a cod, and then we've got the interdigital, what we call foot rot lesions. There's the vaccination. Again, I don't know a whole lot about it, and perhaps if you know, if Maresa wanted to talk about it or anything, but maybe we'd answer any questions you have later on it. But as far as I'm concerned, the main thing is the foot bath, and it's very important that if you're using a vaccine, or if you're using any of these vaccines I talk about, that you're tailoring it so that the peak cover for that vaccine is at the risk time that you need it at. You know, a vaccine produces antibodies, so you want to have the peak antibodies there in that animal at the time in which they need it. Quick word on ORF vaccination. Again, this is only required in farms that have a particular problem with it. ORF is a nasty disease. It's a parapox virus, and you know, when it affects them up around their mouths, they're just not able to suckle, and the poor old animals die of malnutrition more than anything else. The vaccine works well when it's used well in problem places, but it's important that it's not used where it's not a problem, and then it's important not to use it on ewes too close to lambing, in case that you'd end up causing, it's live vaccine, and you end up causing lesions in the poor newly born lambs. Quick word and a very topical thing, and I might ask Maresa to come in on this on blue tongue. So her part of the country down the southeast is probably where we expect to see it first. So I know she's been very vigilant on it, but in the UK at the minute, there is you know, there's increasing concern every day about the blue tongue situation, isn't there, Marisa?
Yeah, absolutely. And we've even had a few, you know, vets onto us with query, could it be it or could it not? Now, thankfully, it hasn't been it. But it's really important just to keep a very close eye on your sheep and cattle if you have it. So they'll all have this kind of swelling, bit of dullness, off form, possibly discharge from the eyes, nose, drooling from the mouth, swelling of the lips and tongues. It affects the blood vessels, so it causes this kind of edema and this swelling. So it's really important just to keep it in the back of your mind. And also, I suppose, again, like we mentioned before, just in the case of abortions or a lot of empty ewes, it's just something to really keep vigilant about. It causes more obvious clinical signs in sheep, but cattle can also be infected. In England, it's cattle that seem to be picking it up at present. It's the strain in England is the BTV3. So unfortunately, there's no vaccine currently available for that, which rules out the use of vaccination. So it just stresses the importance of avoiding bringing it in where we can in live animals. So really avoiding importing animals where at all possible, and trying to get alternatives with AI or, you know, other things like that, or sourcing stock from within the country. And then obviously as I say, in the southeast, if the wind blows the wrong way, and if we're unlucky enough, I suppose it can come on the wind in midges. But it's just something for us all to be keeping very aware of in the next few months, and again back into the summer, especially when the midges. The midges can be active basically any time of the year, depending on the weather. So just to keep an eye for those signs, because it is quite new to us.
Yeah, it's devastating, and especially in sheep flocks when it occurs. If it occurs at the sort of mortality rates and morbidity rates we see on the continent. So the most important thing, the best protection we can give, is that we spot it as early as possible, and that we get the controls in place as early as possible. So and I always put up a slide to try and stay realistic. So the limitations in the lab, and this is, I make no apologies for these things, because you know diagnosis of disease can be difficult, and there's no magic test that will diagnose everything, or that will, there's a lot of these diseases you're relying on the expertise and the familiarity of our people, and you're relying on the diagnostic tests we have available. We're very lucky in Ireland. The network of RVLs we have, and the great cooperation we have with the various PVPs around. A lot of countries don't have that anymore, and my message is all the time that this is something that is meant to be a big support to Irish agriculture, and it's something that we often take for granted what we have. So on a realistic note, then, that it can take time to get results back. What we normally do in most of the labs is we send out an initial report after the gross PM. So most times there's a report gone out within a day or two of when the animal comes into us, and especially if we know that there's a particular problem in a place, we we understand that. We understand that the way you tackle the problem is get the result quickly, and we do our very best to do that. Um, Always worth, if from a farmer's point of view, if you feel that you haven't heard anything from the lab, is check with your vet first off to see if there's any report there, and we'll explain to the vet, or we'll explain to you if we need to, about what the particular limitations are, what we need to do, maybe to get a good answer for the particular problem. In a lot of cases, mightn't get a proper result the first time, and the reason for that is, sometimes we see animals that mightn't be representative of the real problem that's there. And especially when animals have died slowly over time, it takes a lot of further testing. It takes a lot of work to actually get down to what was that initial cause there. And in our case, the more animals we get in, the more submissions we get in, help us see the patterns, get down to what that initial problem may have been, and that's when we can give the best advice. So, stick with us if you have an issue there, and don't we and all our people here, we've great staff. They're all very involved, and they're all very keen to get out good answers there for people, and it's how we get our job satisfaction. So, we're there to help as much as we can. Um, Abortions, Marisa said it earlier about the placentas, and that's crucial. And fresh abortions. We sometimes get in the bag that has been left in the sun, tied usually for a week, and then it's brought into us to try and work out what has caused the abortion a week ago there, or it's been frozen, or things like that. A fresh carcass is the best way that we'll be able to get a worthwhile answer. And then just my final slide to stick up there is just acknowledge, especially all our colleagues throughout the lab network. We're small teams. We're very connected, and I think we work very well together. And we try to provide a good service to everyone. thanks to the farmers that use the RVLs, because it's your cases that we're learning from continuously. It's your cases that we're able to use to warn other people that might stop them having the same problem. So it's a real community effort in that. So we just to thank the farmers that use us, and again our the Teagasc advisors, and we have a close working relationship with Teagasc, especially when it comes to sheep and the problems that are there on sheep. And Teagasc have great advice there on so much of the management things, so much of the problem things that if a bit of a Google and a bit of a chat to the Teagasc advisor can solve a lot of problems on farms. And finally, just to the veterinary practitioners, we rely on the vets to get the results out there, to be our eyes and ears on farms, to give us the bit of information on the background to a case that might be important to cracking it and getting a good answer for the farmer ultimately. So thank you very much, and I'll hand back to Ciaran maybe at this stage.
Thanks, Shane, and thanks to yourself, Maresa, as well. I think you covered a huge range of different conditions, a lot of information. And look, we have a lot of questions in. I'm conscious now we're at the hour, but I'll try to keep them together, and we just get you to keep the answers brief if we can. Look, if we start with the abortive ones, we have a couple of questions in around Enzo and Toxo. I suppose firstly, can you get rid of it if you bring in Enzo into a flock, or is it there to stay? I suppose Toxo is more endemic to the farmer, so.
Yeah, they're quite difficult to get rid of, particularly with Enzo, because say in the first year of abortions, some flocks won't abort that year and they'll abort the following year. They can be a source of infection, so it can be quite difficult. So I guess the advice really would be to avoid bringing it in, obviously if you can, but if you do, then to start your vaccination, because as well as anything, it's a good vaccine, and usually one shot will give you per animal will give you nearly a lifetime cover for that animal. So it's just new sheep you'll have to vaccinate. And particularly with the Enzo, you can really get an abortion storm where you have a huge percentage of sheep that will abort, and that will carry on for a few years. So we've seen farms where they missed a vaccine for a year, or they just didn't get to do it, and it'll pop up again. So it really is a case of keep vaccinating.
I think that's just a point I want to maybe bring up to both of you again. Like in the case of Enzo, and look, this can happen with a lot of different conditions. If it's missed in them initial years, you get that storm, you get a lot of animals aborted. You can still get a bit of residual abortion for a year or two afterwards. That's why even with the vaccine working, there's still going to be a little bit of that, just something maybe to be conscious of.
Yeah, but I do think the vaccine will reduce the impact of it. And I think you really have no choice but to vaccinate in the face of something like that, because you can't take that risk. And as I say, it's a good vaccine, so it's not as if you're going to be injecting the same animal over and over again. So it kind of is one of those no-brainer ones that you just have to vaccinate and keep vaccinating your hoggets and anything that you buy.
And look, I'll just add to that one. I know you throw up Enzo and Toxo, certainly, and they always have been the most common ones. There's a farmer there has a problem with it. He's vaccinating for it, but he's still getting some abortions. I suppose we have to be conscious. You could be unfortunate enough to get one of the other conditions like Campylobacter or something else as well. It's not just a blanket, I'm just going to do them for Enzo and Toxo. You still have to follow up a diagnosis.
Yeah, very good point. And especially if you've been vaccinating for a few years and you should really be coming to the tail end of a thing, absolutely submit again, because she can get Salmonella, she can get Campylobacter. There's a lot of other agents that will cause abortion. So it's really important to make sure that something isn't slipped in there and is being masked by a previous enzootic abortion. So that's a very good point. Is that don't assume that you can't have two agents working together, not together but simultaneously.
The other thing I'd add to that is, the importance of the biosecurity when there's any abortion in a flock. That makes a huge difference to the spread of it, and definitely you can get more than one agent there, and but if in my opinion, if you're seeing a failure of your Enzo vaccination, you need to review exactly how you're doing it. And it's surprising how vaccination, when it comes to vaccines, things like storage, things like doing yours at a time where they might be immunosuppressed. We hit it here with sometimes with outbreaks of what seem to be vaccine failures. And what has occurred is the animals may have had tick-borne fever, or they may have had a disease at the time in which the vaccine was administered, and therefore the immunity that you get from that is just reduced.
I think that's an interesting point, and it's equally as applicable, Shane, particularly this spring, to our clostridial vaccines. Like, you're dependent on a healthy animal to get that immune response.
Yeah, and that's something that I think that people don't always realize with vaccines. With vaccines, you're trying to make antibodies, and in order to make antibodies, you need a healthy animal there. You need an animal that's fit and well and able to metabolize the proteins into forming an antibody that's going to give them protection over time. And it's always a potential reason for failure there that the animals were sick at the time in which they got the vaccine. The other thing we see from time to time is that old batches of vaccine used maybe were stored over winter, or maybe vaccines that were left on the dash of the car and heated up when they should have been refrigerated.
Just two very quick ones when we're on the clostridial. They need to give that booster shot, and I suppose the most vulnerable ones here would be maybe young lambs that did the full primary program, not coming back in again till August. Rams, certainly the other one we see every year. That the importance of giving that annual booster every year.
Oh yeah, it's very important, because as well as that, don't forget that you're relying on that for your lambs. So once your lambs get bee stings, then at least you've the security of a few weeks of cover for them. So it's absolutely vital, and it's not an expensive vaccine, and you really get bang for your buck, because more than blackleg in cattle, we see a lot of purple kidney in sheep. And it's one of these things, there's enough of things out there that we can't cure, that we find difficult to control, but clostridial vaccine should be a given on any sheep farm, and done regularly before lambing. Then hit your lambs again and really try and prevent those problems.
Yeah, look at this one always comes up as well, Marisa, when you touch on that, like the colostrum, making sure every lamb gets its own mother's colostrum from that program. We've a tendency, maybe, especially with triplets, two of them get the mother's colostrum, one doesn't. That's what you depend on for that passive transfer.
Like it's you're at nothing if you can't, if the lambs don't get bee stings, because you're fighting disease then with your hands tied behind your back, and you're really at absolutely nothing. You're going to end up using a lot of antibiotics on animals that aren't going to do well anyway, so you're going to build up resistance to antibiotics. It's an essential part of rearing lambs is to make sure that they all get bee stings.
I'll move off it now, but the last one, it comes up every year. Your clostridial vaccines is used. It's not resealed and used again. It's used them on the day, and just treat appropriately.
Use them on the day, and make sure that you're not puncturing them with dirty needles, that you're keeping them in a bit of a freezer bag, cool, not frozen, but cool if you're going to be at it all day, that you're not going off for lunch. And like Shane was saying, let them in the back of the Jeep, and don't freeze your vaccines. Sometimes we hear horror stories of that they were frozen instead of kept refrigerated or something like that. So just basic common sense, just keep them nice and clean, keep them cold, and use them as quickly as you can.
We still have a lot going. Sorry, Shane. What?
No, the other point I'd just add to that is, and if you feel you have a vaccine failure, if there's some reason that you think a vaccine hasn't worked, it's well worth submitting those to the lab, because you can't assume that it is what you were vaccinating against that has caused the problem. It could be something else entirely. And I see that time and time again, where people just assume it's clostridial disease, and maybe it's a parasite problem, or maybe it's something very simple and preventable that if you had a diagnosis you'd be able to prevent.
Okay, look, we have a couple in on the iceberg diseases, particularly around OPA. Maybe the first one, that the spread of OPA, feed buckets. I suppose Anthony gets sheep in close proximity. You might just explain again how it spreads sheep to sheep, and are feed buckets and that a risk if you have it diagnosed in a flock?
Yeah, so animals. Yeah, sorry, Marisa.
Sorry, Shane, go ahead. No, go ahead.
No, so animals that are at the clinical stage of disease, it's very contagious, and most of it, and that's why we have the Thin Yo survey there. It's our feeling is the best thing that we can do to help farmers with these diseases is help them identify them early. and help them understand that, you know, you have this disease on your farm. Like it or, you know, there's very little you can do about it. You have it, and you're better off knowing you have it, because at least then there are control measures you can take. And you know, it all comes down to trying to identify the individual animal, but you're more likely to identify the animal that might be spreading that to healthy animals if you know you have OPA on your farm. You know, at least you're looking for it. Then you might be more inclined to segregate out the thin yos and keep them away from the hockets. You know, I'm a big believer in, you know, not sticking your head in the sand on these things and trying to, you know, use the resources that are there to get a firm diagnosis and deal with it then.
And especially, Kieran, during housing would be a high risk time. And especially we've seen some cases of OPA in quite young sheep where their mothers had it. So that really close contact plus the risk of spread in colostrum and that as well. So absolutely, any sheep that is clinically sick is a nightmare for spread of the disease, because they're the real Trojan horse. Well, they might even be that Trojan, but they're spreading loads of stuff.
Look at the whole iceberg area, so we could do a whole webinar on. Just on that one, this might be an easy one to answer, but can you import iceberg diseases onto your farm in the form of slurry or family or manure? I suppose Unis maybe is one they might be thinking of in this particular case.
Yeah, you can do all those things, but the biggest risk by far is an infected sheep. So, like from the Medivisna, they can't rule out any of these things as a way of spreading it, but really the sick animal or the infected animal that you've bought in that wasn't showing signs when you bought it in, but then is going on to be clinical, they're the big source of it. So other things are important, and that comes down to basic biosecurity. But with the iceberg diseases, it's the sheep. It's that sheep with the lymph node that's weeping the stuff. That's where all those colonies of bacteria are coming from. Or the Medi sheep that is coughing or has a bit of mastitis, or likewise with the Exita. And then the Iones, it's young sheep that will get that more. And that is fecal oral. That absolutely is fecal oral. But the biggest risk are those sick sheep.
We're a big believer in, you know, common things are common, and like it's the animal moving from farm to farm, the sick animal moving from farm to farm, that is always the culprit there. The problem with these iceberg diseases is that unless you have the records, and unless you have had maybe a quarantine system in place, you know, you can't be certain. You know, these things can be there brewing for 4 or 5 years. They might be brewing for 10, 15 years on the farm for all you know, through generations, and just that you haven't noticed them before now. And you know, it comes back to you know, the best day to deal with this is today.
Yeah.
You know.
I'm conscious I'm over time. I've just very quick bit on fluke, and just we wrap it up then. But Shane, like, is still the main risk, particularly in the northwest, is still liver fluke is the main risk. And just there's a question about control of rumen fluke. You know, you're depending on that product with oxyclosinate as active ingredient. I suppose it just highlights the need to look at your flucoside products again.
It does, but like again, you know, liver fluke is the biggest problem. You know, I think we're probably past the stage where rumen fluke. We haven't seen that many problems with it in recent weeks. Before Christmas, we had quite a few, but it seems to have settled down a bit at this stage. But the liver fluke, you know, these immature larvae and fluke traveling through the liver are you know, up until this week and the frost this week, there was definitely heavy infectious doses out there on the marginal fields. And with liver fluke, and I keep trying to say it to people, you know, it doesn't mean that the whole field is bad. You know, you can have liver fluke in a corner of the field. It can be, you know, there's been studies done there where it's around a drinker or it's around a wet drain is where you get the worst of it. And you know, it's about understanding that this year is a bad year for it, and putting together a sensible approach, both in terms of treatment and moving animals on to clean areas if you have them, and fencing off the high risk areas in fields. That's the only bit of advice I can give to people on it.
Look, you went through the teen mule survey, and it just highlights something there. Like, we're going to see some mules over the next couple of weeks pining, getting thin. We'll see that throughout the year. It really is something to follow up on. I suppose it just it goes in a kind of wrap up question. Some of what you might diagnose this spring is really planning and prevention for next year. It's not always necessarily something we can deal with at the moment, but like for long term planning, it really is the first step. Is getting a good diagnosis of what the issues are.
If you've knowledge, you're in the driving seat. If you don't know what you're dealing with, then you're at the mercy of this unknown thing. Whereas, yeah, finding it out is going to be a bit of a pain. But even apart from the iceberg diseases, you know, if you know what you're dealing with, there's a lot of people out there willing to help you then. You can talk to a lot of people and get a lot of advice and come up with a plan. And the minute you have a plan in place, you're back in control. It's not going to solve everything. We're all realists here. There's no panaceas, but at least if you know what you're dealing with, you've got the knowledge on your side, and you can start making plans and start putting in things. And that's even back to the parasites. Like, if you know what works, what doesn't work, what your bad fields are, what your high risk animals are. Like, I was listening to somebody one day and they said sheep farmers really have to start becoming experts in parasites if they want a long-term prospects in sheep farming. But it's the same with any disease. If you know, then you're in charge.
Now,
And the key of records, sorry, Ciaran, but records in all of that, you know, it's so, I see it myself, like, it's so hard to remember exactly what happened, you know, 6 months ago, 9 months ago. And it's to record the things this year as they're happening, so that maybe by the you get around to next Christmas, you know, you can be looking back, seeing what can I do better this year, and and it's, you know, the unfortunate thing about diseases is they usually just don't go away by themselves. You have to take action, and putting your head in the sand about it isn't going to solve it.
Certainly not. Look, I'm conscious of you both now a good 15 minutes over time. There was a lot to cover. There's a lot of aspects. I know some of the questions we didn't get fully around to. I'd like to thank you both for going on, giving very thorough presentations, trying to go through as many questions. There will be a recording of this webinar to watch back, so if there's anything you might miss during it, we'll have it up on the Teagasc YouTube channel in the coming days. We're going to be back with you on the 7th of February for another Let's Talk Sheep. I'm just going to flag, we have our sheep conference coming up on the 23rd and 25th of January in Athlone on the 23rd and Kilkenny on the 25th. Your colleague Seamus Fagan is speaking to that, covering some very interesting case studies of actually how farmers went about diagnosing and managing problems on farms. So look, that will be very interesting for anyone to attend. So it just remains for me to thank you both for coming on, thank our attendees for tuning in. I hope we got around to as many questions as we could. And again, the recording will be available in the coming days. So thank you very much and good evening to you all.